Welcome and thank you for joining. My name is Trixie Thibodeau, Health Educator for Community Health at Atlantic Health System. Today's webinar, Poison Prevention, Medication Safety in Your Home, and being presented by Karen Jean Fury. But before we begin, I have a couple of housekeeping announcements. The webinar is being recorded. All participants are muted. If you have a question, please use the Q&A for questions or the chat for comments. We will try to get through all the questions at the end of the presentation. Now I'm going to turn it over to Karen.
Okay, well, thank you, Trixie. I appreciate the invitation to speak to everyone today. My name is KJ Fury. I am a nurse practitioner and I work for the trauma service at Morristown Medical Center. And the trauma service at Morristown Medical Center is a verified level 1 center. We were established in 1992. We see about 2,800 patients a year and about 120 pediatric admissions. As part of our programming and to maintain our trauma center verification, we need to have an active injury prevention program. We wanted to make it a community-based program where we engage our community. So our first bit of funding came from from National Highway Traffic Safety in 1998, and then from Safe Kids campaign in 2000. And since then, we generally maintain over 120 partners a year. As far as our outreach programming that we do, we reach close to 15,000 families each year, which is a huge amount of people that we're really giving them some solid information. Our programming is all grant funded or donor funded. And since 1998, we've received over $3 million in grant funding. So what we do to bring these programs is we find community partners. So sometimes they're very local. They may be your fire, your police department, different civic groups you may belong to, but also our partner hospitals within the Atlantic Health network. Our foundation program for Northern New Jersey Safe Kids, Safe Communities is our Child Passenger Safety Program. And here we have a certified RC technicians available to check and work with families to be sure that their car seat is in their car properly. Our mission statement of our community coalition is to reduce fatalities, injuries, and property damage due to unintentional injuries on the road, at home, and at play. And we certainly strive to be the injury prevention resource here in Northern New Jersey. We have a program to maintain our car seat inspection program. We certainly host many car seat training programs that are available. And certainly, if you are interested in becoming a car seat technician, you can let us know about that. Our car seat inspection stations are in Morris County, at the Chester First Aid Squad and the Denville Fire Department. We also have a site at the Mount Tabor Fire Department and at Shade Tree Garage. We kind of cross our borders a little bit into Fairfield at the Fairfield Fire Department, Pompton Lakes First Aid Squad, and up in Sparta at the Sparta Firehouse. Now, not only do we do car seat inspections at these programs, we also provide car fit inspections. And these are inspections where we work with our senior population or our mature drivers to be sure that they are in their vehicle and able to have the safest fit possible. We go over numerous checkpoints to look at their mirrors, their seat situation, and to be sure that they certainly know how to access everything on their dashboards. So if you're ever interested in a car fit inspection, and you are a mature driver, certainly you can come to one of our stations at any time. So our Northern New Jersey Safe Kids, Safe Communities program isn't just for kids, all right? We do cover a lot of different risk areas, such as child passenger safety, traffic safety, pedestrian safety, bike safety, water safety, fire, falls, which is certainly the leading cause of what brings senior patients to the trauma center, home safety, and sports safety. And all of these programs, we have different interactive presentations that we could bring to your community. But today we're going to get right to it and speak about medication safety, and really because this is Poison Control Month here in the US. So this program that I will be presenting to you really came from a collaborative work between Safe Kids Worldwide and Johnson & Johnson. And they together really wanted to teach families how to keep medications in the proper place and not in the hands of children. So kids surprise us all the time. I mean, they're curious, they're quick, they can do things in a flash. So we really need to be up on our game to keep them safe at all times. Many families now have multiple generations living in homes together. So you may have great-grandchildren through a senior grandparent there as well. So we really have a lot of different age groups doing at a lot of different stages of their individual lives. And then we have our curious and very innovative little children who really want to get around and see what they can do. So what exactly is medication? All right. And this sometimes tricks people a little bit. So medication does get prescribed by a doctor, and you receive that medication at a pharmacy with some instructions, and hopefully the pharmacist asks you if you have any questions. But we also have many more medications, over-the-counter medications that we can just go to a supermarket, a drugstore, a small bodega and purchase. And these medications include medications both for children and adults. Not only are they vitamins and supplements and pain relievers, it may be eye drops and ointments and creams. So we really need to be aware of what we have in our house so that we can keep everybody safe. So what we do know, every hour, about 5 young children under the age of 6 end up going to the emergency department across the country because they were able to get into some type of medication. And generally what happens at this point in time is that they have an adverse reaction to the medication, generally because the medication was not prescribed or for them, or they took too much of it, and they suffer what we can call in lay terms medication or medicine poisoning. So who is at risk? Well, we have our very young children between 1 and 4. And again, because they are curious, they're utilizing and exploring all their senses of smell and sight, touch and taste. But we also have our older children, you know, and those are kids between 15 and 19. And these children end up with medicine poisoning generally for 2 reasons. First of all, they may be exploring with medication, or they're taking a medication and not keeping track of what they're taking, and take too much of it. So the types of medications that you may have in your home, you may have pain relievers, and that could be Advil or Tylenol. You may have vitamins or other herbal supplements. Allergy medications such as Benadryl, if many people keep that in, or different types of like hay fever type medications, diaper rash medications, eye drops, laxatives, and then vapor rubs that with camphor in it. Those are the types of medications most households have. And where do children find these medications? Well, they find these medications throughout their house. 23% of the medications are found in a pill box or in a bag of pills. 23% are found on the ground or just misplaced. 19% are in a purse, a bag, or a wallet. 18% are on the counter, and about 8% are kept in a reachable cabinet or in the refrigerator. So one of the things I want to keep kind of highlight here is if you are taking medications, you probably have your own system so you remember to take them, either using a pill box or you keep it in your purse or up on a counter. But when young children do come to your home, we need to alter our normal routines because, again, kids may think that pill box is kind of like a rattle. Children are very curious about what's in a purse. And if sometimes our purses are kept, right near our front door or on a chair near the door. So we want to be aware of those items as well. And whose medication are these children getting in? Well, the majority of them are grandparents' medications. We do have a fair amount of children getting into medications that are for parents, and then also medications for siblings. So we have many people in our multi-generational households taking medications across the board. So how can we store these medications safely? Okay, what does that exactly mean? Well, we need to keep medications and vitamins out of the reach and out of sight of small children, and this needs to happen every day because you never know when that child is certainly going to take his curious nature and find those medications. Okay. And we need to do this because in the emergency department, visits for medication poisonings, parents often say that they just turned their back for 1 single second and then something happened. Research has also indicated that about half of over-the-counter poisonings occurred because a child climbed on something, whether it be a chair, a couch, a countertop, to reach a toy or some other type of object, and they came across their medication. And we also know that research suggests that about half the accidental medication poisonings in young children involve child-resistant packaging. And this is something that many folks think because we have child-resistant packaging, kids can't get into it. Well, that is not the case. These children are very determined. They have very good dexterity, and they can certainly open these packages or small bottles very, very easily. So really what we need to do is these medications need to be up and out of sight every time. We can't just leave them out in full vision for these kids. So what can we do to give medication more safely to our children? Okay, well, first of all, we need to read the label. And we need to know exactly that we're giving them the exact amount of medication. We need to know how much and how often do we give the medication. We need to know the active ingredients in the medication. Many times we see children coming to the emergency department because they're taking medications that have the same active ingredients. So they may be taking different medications that have antihistamines in them, and then they have an adverse effect. We need to read the warning labels and certainly know about them. And we also need to use the dosing device that comes with the medication. Now, many of us, I'll say most of us in the areas that we live in, are very lucky that we have a full set of silverware. We have teaspoons, we have tablespoons, we have different types of measuring spoons, but we also need to be sure that we have the medication, the device that came with the medication to dispense that medication. Because if we're just giving a tablespoon of medication or a teaspoon of medication, it from regular silverware, it may be more than we should be giving, just because those utensils are deeper and wider than a true measurement through a medication dispensing device. The other thing we need to do is we need to keep a schedule. Many times when we have children who are sick, or if we're sick with the flu, we should write down what medications we're taking when. We may be sleeping in between, the kids may be sleeping in between. We certainly do not want to give medications earlier than they should be taken. And if we have multiple kids in the house, you know, we want to use which kid we're giving the medication to so that we all are aware of it. We want to put down the date and time and the amount of medication that was given to this child, you know, and we certainly want to identify if it was a scheduled dose that was given. So sometimes we may need to set some reminders. You know, we all have very busy days. We could set a reminder on our phone, utilize our different timers that we may see, put a note somewhere to take the medication. But if you have a medication that needs to be taken, we want to be sure that we're taking it. And just leaving it on a nightstand because we need to take it first thing in the morning is not the safest way to handle that. So if you have any questions about your medication, even once you pick it up from the pharmacy or you purchase it in the pharmacy, never hesitate to call your doctor. You can always call the pharmacist, and you also can always call the Poison Helpline. Now, we suggest you keep the Poison Helpline number close at hand. They do have small stickers that we can put in cabinets, but the number is 1-800-222-1222. And they certainly can give you information on medication that you will be taking or you anticipate taking, and looking at some side effects that may occur from it. So to call the Poison Hotline, as I just said before, you can call when you have a question, about giving the medication. If your child or an adult was given the wrong medication or the wrong amount, they can guide you through that process. Or if the child or adult took medication that they should not be taking, what should you call? So when should you call 911? All right. You want to call 911 when your child stops breathing, when your child or an adult collapses, or if your child has a seizure or is unresponsive from medication that they may be taking. So you want to keep that phone number handy. Okay, 1-800-222-1222. And certainly they're open 24 hours a day and truly are a wealth of information and very, very active here in New Jersey, assisting the residents making some safe decisions about medication. So the other thing we need to think about is disposing medication. What do we do to get rid of medication that we're not using anymore? Well, one thing we can do is we can kind of hide it. So you want to put it in coffee grounds, in dirt or cat litter, and then put it in a sealed container and throw it in the trash, okay? You can want to remove your personal information from that packaging. So that's not just, accessible to anyone. So you want to cross that out or tear it up if possible. The other thing you want to do is be sure that you, to be aware of your community take back days. And these are days in the community where the police departments generally set up kind of like an event where you can bring medications and drop them off. Many police departments in Morris, Warren, and Sussex County also have a drop-off box in their police departments. So you can bring pills and powdered medications there. Some of them do not take liquid medications, so you would need to double check on that. Certainly, you want to share medication information with the other parents or caregivers or babysitters who may be caring for your children if they are or needing medication, so that they have the current information. And you also want to be sure that you can use resources within Safe Kids Northern New Jersey to help you out with any injury prevention programming that you may be looking to have. Here, you can follow us on our website, preventionworks-nj.org. We also have a very active social media presence with Safe Kids Northern New Jersey on Facebook, and then on Instagram, Safe Kids North NJ. I also listed my email address there, karenjean.fury@atlantichealth.org. And certainly, I'm up for taking any questions that you may have at this time.
All right, thank you so much, Jean, for your expertise today. Well, thank you everyone for attending today. And please, again, if you wouldn't mind doing the survey at the end of the program. Have a wonderful day, everyone.